Good afternoon, Rolls weigh in. Let's begin the warm-up session. What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Your preparation time is over. Please start your OET-speaking roleplay.
Hello, good afternoon. I am Roleplay, your attending nurse. For documentation, please tell me your full name and age.
Good afternoon. My name is Mihiraa and I am 25 years old.
It's good to see you today, Mihiraa, though I'm sorry it's under these circumstances. I understand you've been experiencing some discomfort with a skin condition, so let's discuss that together. I'm here to help you understand what's going on and to work on some solutions that can ease things for you. First, your condition is identified as contact dermatitis, which is the likely cause of your symptoms. Contact dermatitis usually occurs when the skin reacts to something it has come into contact with, often a new product or material. To help pinpoint what might be causing this, could you tell me if you've recently been exposed to new substances?
Yes, actually, I did start using a new face wash last week, and I also tried a different kind of body lotion. Now that you mention it, I think that's around when my skin started acting up. And I've been wearing a new bracelet as well, but I hadn't really thought that could be connected.
Thank you, Mihiraa, that helps give us some clues. So, let's talk a little about what contact dermatitis actually is. In simple terms, it's when the skin becomes irritated or inflamed because of an irritant or allergen. The skin responds to these substances by becoming red, itchy, and sometimes even swollen. One thing I'd like to reassure you about is that it's not contagious, so it won't spread to others. The good news is that contact dermatitis generally improves once we identify and avoid the trigger. Until we pinpoint it, though, there are some steps you can take to make the skin more comfortable. Mihiraa, for instance, tries to keep the affected area clean and dry, as dampness can worsen irritation. Using a gentle, fragrance-free moisturizer can also be very helpful in keeping the skin soothed and preventing dryness. It might also help to avoid scratching, even though I know it's tempting because scratching can increase irritation and make things feel worse. How does that sound so far?
That actually makes a lot of sense. I didn't know it wasn't contagious, so that's a relief. I think I can manage keeping it dry and using a gentle moisturizer. I'll do my best not to scratch, though it's hard when it's so itchy.
I'm glad the information was helpful, Mihiraa. Now, let's go over a few treatment options for managing the irritation. For mild cases like yours, an over-the-counter hydrocortisone cream is often effective. You can apply it lightly to the affected area to help reduce inflammation and soothe the itch. If the redness or irritation doesn't improve or if it becomes more severe, it would be best to consult with a doctor, who can prescribe a stronger treatment if needed. I'm here to answer any questions you might have about these options, or if there's anything you're worried about in terms of treatment.
I think I'd like to try the over-the-counter cream first. It's good to know there's another option if this doesn't work. So far, it's mostly just uncomfortable and itchy rather than really painful, so I hope the cream will help with that.
That sounds like a great plan, Mihiraa. Now, to help prevent this from happening again, let's talk about ways to avoid potential triggers. To reduce the chances of future flare-ups, there are a few simple steps we can try together. First, consider using hypoallergenic products for your skincare and even household items, like laundry detergents or cleaners. These are designed to be gentler and less likely to trigger irritation. When handling cleaning products or doing any activity where your skin might be exposed to chemicals or rough materials, wearing protective gloves can really make a difference in shielding your skin from potential irritants. One more precaution I'd recommend is to patch test any new product before using it on a larger area. This can be as easy as applying a small amount on a spot like the inside of your wrist and waiting 24 hours to see if there's any reaction. That way, if your skin does react, it's only in one small area, and you'll know to avoid that product. It's a little extra step that can prevent a lot of discomfort later on. Does that approach seem manageable for you?
Yes, that's something I can definitely do. I hadn't thought about patch testing, but it sounds like a good way to be cautious without having to avoid new things altogether.
Excellent, Mihiraa. One last thing that might help you feel more comfortable is incorporating some soothing measures when you feel itchiness or discomfort. A cool compress applied to the affected area can really help reduce itching and calm inflammation. Some people also find oatmeal baths very soothing, as the oats have natural anti-inflammatory properties. When washing, try to avoid hot water and harsh soaps, as they can dry out and further irritate your skin. Keeping your skin moisturized will create a barrier against potential irritants and protect it as it heals. Do you think these tips would work well with your daily routine?
Yes, definitely. I think I'll start with the cool compresses, and I'll try an oatmeal bath if it doesn't get better. Thank you so much for these suggestions. I feel much more confident about managing it now.
It's my pleasure, Mihiraa. Alright, let's go over everything we discussed to make sure you feel clear about managing your skin. You're dealing with contact dermatitis, which means your skin has reacted to something it came in contact with, likely that new face wash, lotion, or bracelet. It's not contagious, so no worries about spreading it to others. The key here is to avoid potential triggers, keep the area clean and dry, and use a gentle, fragrance-free moisturizer to prevent dryness. Mihiraa, for treatment, starting with an over-the-counter hydrocortisone cream should help reduce the itching and inflammation. If it doesn't improve or gets worse, a doctor can provide stronger options. Also, to avoid future reactions, try patch testing new products and consider using hypoallergenic items. And lastly, for immediate comfort, cool compresses and oatmeal baths can soothe the itch. Avoid hot water and harsh soaps as well, since they can make the irritation worse.